first. We're looking at stories making news and medical hot topics. Joining us on our panel discussion, cosmetic and general dentist Dr. Terry Alani, neuropathy specialist Dr. Bao Tai, and optometrist Dr. Julio Arroyo. Good morning.
Good morning. Good morning.
All right, one of the hot topics here, and this should be of no surprise, I think, really, but it's just because we're dealing with babies that a lot of us are shocked. 95% of baby foods contain toxic metals. They were testing 168 foods. 95% had lead, 73% had arsenic, they had cadmium, mercury, and a fourth of them had all four of those things. And I guess we shouldn't be surprised because a lot of that stuff is in our general food as well.
A lot of it is in the soil, especially the rice. I was sort of surprised. And the thing is that I would relay to consumers is not to panic, but just to use common sense when you're feeding your child and use a variety of foods so you're not using just one.
Yeah. And they're saying they're concerned, though, is a lot of these things can cause damage to brain development and certain other things. But the other thing we have to look at, too, is are we finding traces of it? You'd rather probably none be in there, but traces of it, or obviously when it's enough to cause brain damage stuff, it's got to be at higher concentrations.
Yeah, well, a lot of it's just common sense. You know, you got to, the way that these things are grown, you know, like Dr. Lonnie was saying, it's the metals are in the water gets absorbed into the fruits and the vegetables. So you just got to, you know, do what you can. But when you look at the development of a child, it's such a critical stage that you have to be as protective as possible to, you know, do what you can.
Yeah.
Well, I think the real concern is what the preservatives and fillers that are put in there just for profit as well.
Yeah.
So I think the big concern here is not what is in the soil. I think the organic soils are the way to go, but we have a problem with manufacturing. I think that's where the public person should be.
Yeah,
Right?
it's inorganic that they're concerned about. But they say that the percentage has declined over the years, but this group is very proactive in showing the consumers, and the FDA is actually getting involved. So I think we'll start to see some improvement.
Yeah, and we're coming full circle again back to the freshest is the best, right? Parents should offer more veggies and multigrains.
Don't you wonder how we made it this far healthy?
Right.
It's amazing, yes.
All right, elite athletes have poor oral health for some reason. Now, you got to take with a grain of salt any kind of research that's done. You want to point out some things here.
Okay, so I was reading that, and the study was done in Great Britain, and so they surveyed the athletes in Great Britain, and the standard of dentistry is a little bit different than it is in the United States. So we have to take that in consideration. But the problem is that a lot of athletes, instead of using water, they use the energy drinks. The energy drinks, number one, have tons of sugar, and the second thing is the acid can corrode the enamel over time. So that's the problem with athletes. Also, through intensive training, they get dehydration of their mouth, so their saliva is not distributing and getting rid of all of
Which a lot of patients who have naturally a lot of saliva usually have fewer cavities. And
yes, they do.
Yeah.
They do. And so the takeaway with this is for athletes really to not just drink the energy drinks, the energy gels, but also to drink lots of water, because a lot of them do brush and floss. And I think probably in the U.S., the percentage of athletes that have this type of decay is probably much less.
All right.
I think the doctor just said about the sugar. I think it's a great point. But one of the things that we see in athletes is that, particularly the elite athletes, well, they obviously sweat a lot. That's a problem because you lose a lot of minerals. So you don't have the right diet, you don't put back those minerals. One of the things that happen is your teeth get sick, right?
Yeah.
I would figure that.
Yeah, and then if your teeth get sick, your eyes get sick,
Teeth
everything
get
gets
sick.
Yeah, that's
I like
that. Yeah, sick. Well, sick can go both ways. Oh, look, your teeth are sick. or you can be like, your teeth are sick. Okay, all right. This next study said a single injection gave mammals night vision. And they're looking at this as a way to help people, human beings, be able to see better.
Well, first of all, we as humans, we can only see between 400 and 700 nanometers of the electromagnetic light spectrum.
See, this is the reason why they go to medical school.
so basically, it's a very small range of a very wide range of light. So what they are doing is to put a photoreceptor in there. They inject a substance that converts inside the photoreceptors so it can actually be more sensitive. You can do that now with machines, but it would be kind of nice to be what if we see a spirits or so or ghost out there? Because now we can see, like, I'm kidding, of course, but
Yes.
the point is that
Now's the time.
But the point is that, yes, you can inject a substance and make those photoreceptors to be more receptive to other wavelengths.
Huh. Speaking of receptors, wasabi receptor may advance treatments for chronic pain.
Sure. So this study was interesting. They were studying how certain foods opens and targets certain receptors in your body. And when you look at pain and whether it's acute pain or chronic pain, we're trying to figure out how do we deal with it, right? So we know with the opioid epidemic, and then with CBD and marijuana, all these things on the rise, that is the number one thing that's constantly plaguing us. So the study was trying to figure out how do we target certain receptors to do certain things. Mm-hmm. And if we can figure out those channels and how to turn things on and off, it can help people deal with pain, but in a natural way.
Yeah, all right, wasabi. Mm-hmm. I think the way it helps you deal with pain is that it is so hot that you forgot you had some pain. Right? You're like, what's going on here?
Other foods are like mustard, garlic,
Mustard,
onions.
garlic, onions, yeah.
All of those. So it's interesting.
Yeah, all right. This next one. Can Viagra permanently damage vision?
I wouldn't know anything about that.
Well, yeah. Well, they always said it could make you go blind.
I don't know.
They always said it could make you go blind anyway, right? So it related here.
We've known for a long time that Viagra, it actually influences the blood vessels, so it increases the blood vessel flow, so you can get an erection, right? It works very well for that. But of course, in certain individuals, that have what we call discs at risk, and the disc is the nerve that connects the eye to the brain. So if that nerve has a very specific anatomy, it can actually cause an optic neuritis or non-arteritic optic neuritis, which is a condition where blood flow actually shuts down, and then you can go blind. But now, for some reason, they still don't understand the mechanism why that happens. It can actually poison the photoreceptors. So now you use your color vision is no longer normal. You lose certain parts of the spectrum.
What they were saying here is people who are taking over the recommended dose. So
correct.
So here's the deal,
Yeah.
Deborah.
Yeah.
It's everything in moderation.
Yeah, exactly, right?
Right?
Or follow
Right.
the directions.
Follow the
Yeah, because
directions.
I'd hate to go out and buy the nice new negligee and everything. It's like, look, over here, over here. All right. Okay, so yes, everything in moderation and follow directions and keep talking to your doctor. All right, doctors, thank you very much.